What's up, everybody? Welcome to another episode of Outside the Box. And we have, by popular demand, back Dr. Denise Sammons from Sozo Life and Wellness. I apologize.
Okay.
You know, my words are jumbling. How you doing?
I'm doing well, thank you.
I'm so happy to have you back. And today we're talking about a topic that has stumped a lot of people, including myself, and that's Lyme disease.
Oh,
And
yeah.
it's something that affects so many people. A lot of them don't even know it.
Right.
Why don't you just kind of do an intro in terms of what is Lyme disease?
Yeah. So Lyme is a very multifaceted disease, and people think of Lyme as having a tick bite and a bullseye rash, and it goes much deeper than that. In fact, most of the people that I see have never had that tick bite. They've never had that bullseye rash. So you can actually contract Lyme many different ways. If someone has Lyme and you kiss them, you can contract Lyme. It's sexually transmitted. You can get it from any biting or stinging insect. You can get it if a mom has Lyme and gives birth, she passes it on to her baby, and also through a blood transfusion.
Wow.
Many ways to contract Lyme, yes.
So is it like it's an autoimmune disease? No,
it's a bacterial infection that.
Okay.
Yeah, it's a bacterial infection. So
Borrelia
burgdorferi. I'm just here. You're brushing off on me here, Ben. So that is the most common form of Lyme. That's what the disease was actually named after. So there are 41 strains of Borrelia.
Okay.
And if you go to a doctor, typically they're just going to check you for the one strain. And if you test negative, then they're going to say, you don't have Lyme. And I've seen that multiple times.
So what are some symptoms? So say you don't know if something's going on, I'm not sure what it is. What might be some things I'm feeling?
It is the great imitator. Lyme is the great imitator. I have seen people come in with MS, and it's Lyme. I've seen people come in with migraines, and it's Lyme. I've seen people come in with autoimmune diagnosis, and it's Lyme-based. From fibromyalgia, I mean, I can tell you so many diseases that it is called the great imitator, yes.
So how do you test in the sense that, okay, symptoms look like just an autoimmune disease or MS or whatever? What signals you, okay, this is Lyme?
Well, I have had people in my practice that have come in with just a headache, and they didn't know what it was. And, neurological disease, a lot of times neurological symptoms are Lyme-based because they release neurotoxins into the body. And I had a gal come to me several years ago that had a severe headache and neurological symptoms. She'd had it for months. Her mom had her to 10 different specialty doctors in the Tri-Cities. And she had taken her to 3 major hospitals, UVA, Vanderbilt, and I can't remember the other one. And nobody could figure out what was going on with her. And we energetically tested her. So I go through a process where we test for various pathogens in the body and toxins. And when I tested her for bacteria, Lyme was a heavy stress in her body. The Borrelia bacteria was a heavy stress.
So it's a bacterial infection, and the bacteria is Borrelia.
Borrelia, and there's 41 strains, but there are often co-infections with Lyme too, Ben, because that's what most of the time a lot of doctors will miss those. They'll just treat with an antibiotic and go after the bacteria. But there are many co-infections of Lyme. Bartonella is one. People with RA have Bartonella in their joints, and that is one of the co-infections of Lyme.
What is a co-infection?
Okay, so it's something that typically is paired up with the Lyme bacteria. So Bartonella is one. Babesia is another.
And this is not one of the 41 strands of...
No, it's a separate pathogen. It is a totally separate pathogen that's often paired with the Lyme. And so if you don't treat that, people don't get well. So what we're seeing again with joint pain, and I'm sure people who have had COVID and they've treated with ivermectin, and I've had them come in my office and they're like, boy, those 5 days I was on ivermectin, my joint pain stopped. And I was like, well, that's probably because you've got some parasites in your joints. Yeah, and that targeted the parasite infection, and it actually gave them relief for 5 days. But if you don't continue that on a cycling basis to kill the eggs and go through the life cycle of the pathogen, it's going to come back.
So when you say pathogen, is a Lyme a Lyme disease, is that pathogen?
It's a bacteria.
So
yeah.
that's
you've
not
got,
a pathogen.
Yeah. Well,
Okay.
yeah, it is. It's a pathogen. So you think about 4 pathogens. You have the largest pathogen in the body would be a parasite. And everybody thinks, oh, a tapeworm or a liver fluke. Well, parasites are not always worms. I mean, you could have a roundworm, but most parasites are microscopic.
Yeah.
So you can have something small like a Giardia that, and still, even something microscopic in the form of a parasite is the largest pathogen in the body. And then the next size down is going to be like fungi, fungal infections. And then right underneath that is bacteria. And then underneath that is a virus. The virus is the smallest. So when you're dealing with someone who has Lyme or any patient, for example, with any kind of infection, you always want to target the largest pathogen first because they will house the smaller pathogens. Okay, so when we're dealing with a Lyme patient, we always start with a parasite cleanse. Now, sometimes I will actually start by knocking the fungal load down in the body because a fungus or a fungal infection will produce mycotoxins, and those are chemicals that really suppress the immune system. So if that is the highest stress in their body, we have to knock that down to give the immune system a break, bind up those mycotoxins, and then we'll start working on the parasites. And when we do antiparasitics, and the parasites start dying, they release toxins back into the blood. So they're going to be releasing metals, heavy metals. Parasites can bind.
Because you're killing the parasite.
Yeah, because they bind up to 7 to 8 times their body weight in heavy metal. And so when they die, everything they've been eating, your blood becomes the toilet. So all of that just dumps back out into the blood. So you have to make sure you give binders to people when you do a parasite cleanse, metal binders, and also things to help their liver, their lymphatics, and their kidneys to push this stuff out because people get really sick and they feel bad. They'll get a Herxheimer response, which is more die-off than the liver and the kidneys can push out of their body.
Interesting.
Yeah.
Well, there's a lot there, folks.
Yeah, that's a mouthful, didn't I?
So a parasite cleanse,
Yes.
That's when you would put somebody cyclically on some sort of anti-parasite.
Sure. We usually, when we test again, they may have worms and they also may have protozoal parasites. So we have different herbs again that target certain pathogens in the body. So we energetically test them to see which herbs work best for them. And we'll generally pair 2 to 3, sometimes 4, depending on what they're dealing with, 4 herbs. And we cycle that 5 days on, 2 days off. And we do that for 4 weeks. Now, after we complete that cycle, we also do what's called a full moon. Right now, while we're filming, today is the first day of what I would call a full moon cycle. A full moon occurs every month. So 2 days before that full moon, the pathogens start to come out and replicate. And during that 5-day process, so 2 days before, the day of, and 2 days after becomes a full moon cycle. So after we complete the 4-week parasite cleanse, then we have people continue for 4 months doing what we call a full moon cycle of antiparasitics because they go into hiding. They love the joints. They love scar tissue. They will go into hiding and then they come out at the full moon, and I tell people they come out and party. That's why people have symptoms at a full moon. Oftentimes fibromyalgia and people with autoimmune, they say, their symptoms flare, and I'll say, notice if it happens around a full moon. Or we get calls in our office when we're working with people, and they're like, oh my goodness, I've got the worst brain fog right now, or I've got the most pain, or my head's hurting. And I'm like, remind them that it's a full moon and they're in that full moon cycle and things are replicating. And that's a great time to go back in and try to, mop up what didn't get killed the first round. So we will continue to do those full moon cycles to kind of clean things up.
And how long would it take to completely wipe out the parasite?
It varies from person to person. I had a gal a few years ago from North Carolina that came off the mission field, and she was so sick, and she had been diagnosed with MS. And this is a perfect example of someone that had Lyme. And she had a horrible parasite infection. And what was interesting is this girl came in with a stack of paperwork this tall, and she'd been to an integrative doctor over in Asheville. They'd done a lot of testing on her. And when I went through my energetic testing and I, shared with her what I found, and I said, we're going to start with a parasite cleanse. Oh, no, I don't have parasites. I did my stool test. Look, it's all negative. And she's flipping through it. And I said, you're energetically testing for parasites. You've got some worms. You've got some other things going on. I said, just humor me with this and let's do a parasite cleanse. And let's start with this. So 2 weeks into the cleanse, she was emailing our office and she's like, I'm dumping worms in the toilet. And, she was actually happy because this gal could not gain weight. She was tiny. She had had problems gaining weight for quite a while. And, the worms were basically eating her lunch. And so, we continued to have her do full moon cycles. 4 months after the initial cleanse, she was still dumping worms. That's how heavily infested she was. Now, not everybody has worms that they pass, but this gal did. But the cool thing about it is her weight started to come up. And so she sent me a picture of her scales one morning. And she said, I haven't weighed this since college. So that was cool.
That is wild.
Yeah.
It seems like so much of, specifically with Lyme disease, has to do with knowing what to look at first.
Yeah.
And what you're saying is you like to start with the parasite.
You have to start with the biggest pathogen, because if you don't...
And the parasites are always the biggest?
They are always the biggest.
Okay.
Even the microscopic are still the largest pathogen in the body. And if you don't start with that and you try to clean up another pathogen, you may have some of those bacteria or those viruses living inside the parasite. And then say you wipe everything else out in the blood, well, they can come back out and infect the body. So you want to start with the biggest one and you want to go down the ranks, basically. Now, when we do a parasite cleanse, and I know that there's another pathogen involved or other pathogens, I have to give some low dose of those antibacterials or antivirals, because that's going to be released into the body. And that can actually make people sick.
Right.
Yeah.
So you got to cover that, because the way I picture in my head is you basically, like the parasite is like this big
might
ball,
be like a house. Yeah,
and
basically.
you're basically shooting that and then it bursts, and then everything inside of the ball is released into your system.
Exactly.
And that other stuff could be, bacteria,
There are other pathogens.
infections.
Yeah, there are other pathogens that are smaller in size that are released out into the body, but also the toxins that pathogen has been eating. So heavy metals and just the things that they like to live.
So you're just going to feel terrible.
Yeah, you can, but you don't have to. And if you work with a practitioner that is trained in that, they're going to give you things to help support those detox responses that we call a Herxheimer response. Now, I also test people energetically to see how they're methylating, the methylation pathways, because a lot of people have that gene mutation, and that means they can't push toxins out of their body that well. So we want to give what we call a methylation support product, and then we also during that process give metal binders, and we also use proteolytic enzymes where we give those on an empty stomach, because when parasites die, they release fibrin into the blood, and that fibrin can actually thicken the blood. Okay, so we want to go in. Think of a proteolytic enzyme as a Pac-Man for the blood. So it's going to go in and it's going to gobble up fibrin and non-living tissue. It can clean out the arteries of plaque. It has a lot of different functions.
So that would be good for lots of different things.
Oh yeah.
So it seems to me like if you were to treat the Lyme, start the parasite cleanse. You could clean up a whole bunch of stuff.
Oh, you can. Yeah, definitely.
And someone who's been used to feeling bad for so long, could like turn around real fast.
Oh, yeah. We see that all the time. I've got some really neat testimonies here in the last little bit about people that have turned around from 20-year fibromyalgia, in 4 weeks doing a parasite cleanse. I've got a lady I'm working with down in South Carolina, diagnosed with Epstein-Barr uncytomegalovirus, and she'd been treated with ozone and all kinds of things, still hadn't gotten better, came to me, and I could tell when I energetically tested her that parasites were the heaviest strain on her immune system. And so we started with a parasite cleanse, and just doing that parasite cleanse turned her world around. It totally her energy levels came back. She was able to work. It was just a life changer for her.
Do you look at a Lyme patient as a Lyme patient, or do you look at a Lyme patient as a, basically like a parasite type situation?
Well, we're always going to always test for parasites, and then the next thing we're going to target is a fungal infection, and
with Lyme.
With Lyme,
okay.
Yeah. Anybody that walks in my office, no matter what their diagnosis, they could come in with RA, they could come in with fibromyalgia, they could come in with MS. I don't care what the diagnosis, because in my mind, a diagnosis is what they have been given because they have a collection of symptoms, and that's the name they've been given. Right. I'm not really, my concern is what pathogens are in your body, what toxins are in your body that cause those pathogens to want to hang out there, and even more than that, what was the emotional trigger that drew the toxins to that area of the body, that drew the pathogens there, that caused the disease process to start to begin with. So we're going to do all of those things. Yeah.
Well, it makes so much sense, because it seems to me like nowadays it's like kind of a little cliche for somebody to diagnose somebody with Lyme disease. It's like, if they can't figure it out, you got Lyme. Yeah. Does that make sense?
That is.
It's almost like the old fibromyalgia.
Well, it is. And, fibro is, a lot of fibro I've seen is Lyme, and some of it is actually a viral infection as well. So you've got to know, but, again, a fibro patient that was in my office, 4 weeks ago, 16 months post-COVID long haulers, and we did a parasite cleanse on her, and it changed her world as well. Most of her pain went away just doing the parasite cleanse. I mean, it was amazing.
Can you give us an example of what a parasite cleanse would be?
Sure.
I know you mentioned some of the stuff you're using, but just for
like how we would work through it. Yeah. So you would do a proteolytic enzyme to go in actually and dissolve fibrin in the blood that's released by the die-off. You would use antiparasitics. Some of the more common ones would be like artemisinin. We have a product collection by Systemic Formulas, which we use the CXVRM1, 2, and 3, and 4, and we energetically test for those. You can also use diatomaceous earth for the larger pathogens like worms. Nutrimetics has some great products, Anula, Mora, Kina. Those are all great herbs. Hatunia is great for Bartonella. Again, the joints, the joint pain. Cistus tea is another herb that is phenomenal. Anytime you're dealing with Bartonella, you also are going to see retroviruses in the body, and those are really hard to get out, but they're always paired together. I learned that at a Lyme conference years ago. So, again, looking at the pathogen and then giving a metal binder, because that metal getting released when those things die, we do not want that getting reabsorbed back in the body. We want to carry that out. We want to bind it up, carry it out. We also want to support bile production in the body. So a lot of times people are not producing enough bile. Their liver's not functioning optimally. And we want to make sure they're producing enough bile, because the bile will bind up the fat-soluble toxins that need to go out of the body. So, again, a lot of things go back to the gut and digestion. We want to make sure people are having 2 to 3 bowel movements a day. And people are like, I feel like I'm a rock star pooper if I'm going once a day. And I'm like, if you're eating 3 meals a day, we got to get that going a little more, So, we'll give magnesium to kind of pull water to the colon and flush things out. Make sure they're drinking plenty of water. That is key. Take half your body weight in ounces, and that's the minimum number of ounces of water that you want to consume. But anytime you're doing a cleanse, you actually want to increase that water consumption, because we're pushing things out.
Right.
And then we also give support for the liver, the lymphatics, and the kidneys. Sometimes we use glutathione. I use a liposomal form of glutathione. And sometimes we use a product called Berber by Nutrimetics, which is liver, lymphatic, and kidney support. And the other product that I really like, because when you're dealing with pathogen die-off, you also have neurotoxins that are released into the blood, and you get the brain fog. Even sometimes with candida cleanses, people are getting the brain fog from the candida, the acetaldehyde that comes off the candida. So we use the Pinella a lot for that. And sometimes we pair Berber Pinella, depending on what they test for and what their symptoms are. So
that's really interesting. So it sounds to me like, a lot of people who either have Lyme or suspect they might have Lyme, there's like a little bit of a lack of hope around that. And what's your message to those people?
Oh, there's always hope. There's always hope for healing. If you're willing to change your diet, make dietary changes, because when you're killing pathogens, you can't eat sugar. Sugar feeds pathogens. They love sugar. They love heavy metal, and they love all the garbage and the toxins. So you've got to come off sugar. You've got to go to a low-carb diet, because carbs turn to sugar. You've got to eliminate alcohol. Alcohol turns to sugar. So then you start with your diet, and then you start going through again, with a parasite cleanse, it's 5 days on, 2 days off. You do that cycle. Then when we start a Lyme protocol, we actually work very slowly and titrate people up, because if you go full dose with a Lyme patient, you're going to give them the most incredible Herxheimer response, and they're going to get sick, and they're never going to come back, and they're going to hate you.
Explain that to me. So
Herxheimer?
Well, you don't want to go full blown after everything.
Okay.
So you want to go.
So with a Lyme, so with a Lyme protocol, I mean, I literally have had patients have a Herx response with 1 drop of an herbal. So, again, we're going to energetically test a group of herbs that we have that work specifically on bacteria. 2 common ones that test well are cat's claw, which a company, Nutrimedics, has a product called Cemento. And then I also use a product line called Research Nutritionals, which makes liposomal herbs. Some people test better for liposomes when they have gut dysbiosis, but also when they have the pathogens go to the brain, because you got to find something that's going to cross the blood-brain barrier and get to those pathogens in the brain.
That's really interesting.
Yeah.
So that would be the protocol essentially, but with specific.
So with Lyme, we start with a low dose. We start with a drop of each product. Usually there are about 3 tinctures that I will have them work with, and then we titrate up every time they take a dose. So if they twice a day they're going to do this. So each time they take a dose, they go up 1 drop till they build to what we call a full dose. And that's typically, anywhere between 30 to 60 drops, depending on the product that we're using. So sometimes along the way, they have a Herxheimer response. They get sick because there's too much die-off. Their body can't get rid of it. So we have to slow down, back off.
What would an example of like a
Herx response look like? So nausea, severe fatigue, headache, stomach cramps, brain fog. Oh, that's the biggest one people are dealing with, is brain fog. So those sick feelings where there's more toxins than the liver and the kidneys can get rid of, and you feel sick because you're backed up.
Okay. Yeah. And you're trying to avoid that, and to do that, you're basically...
We're supporting methylation pathways typically, and we're also using the berber, which is the liver lymphatic kidney detox product, and then also glutathione works really well too. Glutathione, and then if they have a Herxheimer response, we have them on a regimen of doing this product so many times a day. But if you have a Herx response, you just take extra doses, like every 15 minutes until your body relieves, because you're actually just supporting the kidneys and the liver, and you're pushing that stuff out.
It's just Lyme disease is a fascinating thing. Mm-hmm. It's so misdiagnosed, and obviously, with what you're saying, there's so many different strands of it.
Yeah,
and
there are 41 strains of Borrelia. Yeah.
Are most of the people that you're seeing with Lyme, do they know they have Lyme, or?
Most people don't. Some people suspect it, but honestly, most people don't. I had a girl come in my office years ago, and all she had was a low-grade fever, and she'd had it for several months and couldn't get rid of it, and her mom had her again to a lot of doctors. We tested her, found it energetically. She took her doctor, and she actually tested for Lyme, which is rare. But because I would like to say this for most people, if you go get a blood test, it's rare that it's going to come up positive, because if it's been in your body any length of time at all, it goes into a cyst form. So basically, that is just like, as my mentor, who is a world-renowned Lyme doctor, says, it's like a ball of snot. That's not a very, that's not a great medical term, but that's a good description of what it is. And it goes into a cyst form, and it can morph between that cyst form, and then it can come back out. Now, Lyme bacteria is what we call a spirochete. So that's a spiral bacteria, and those can actually drill into tissue, and then they will cover with a biofilm, and they hide. So if you take a blood test, it's not going to always show up in the blood, especially if it's in a cyst form or if it's gone into tissue. So you have to break that cyst down, you have to break that biofilm down, so whatever antimicrobial you're using can actually attack the Lyme bacteria. Even in an antibiotic, the traditional medicine world would be wise to use these proteolytic enzymes to dissolve those biofilms and those cysts, so the bacteria, because when that bacteria, and that antibiotic comes in the body, all it's going to do is go in the cyst and hide. And then they're going to feel great because it's not active, and they're thinking, oh, this is working. But you get them off the antibiotic 6 months later, most people have, a recurrence of some type of symptom because it didn't clear the bacteria.
So what's the difference between getting it to hide and actually clearing it? Like what has to happen there?
Well, you've got to dissolve the cyst, you've got to dissolve the biofilm, so whatever you're using as your antimicrobial agent can actually get to the bacteria and kill it. And again, sometimes in the traditional world, doctors don't use antiparasitics, and so they actually have not cleared the house that the Lyme bacteria can live in. So they clear something in the blood, but there's more living inside a parasite, and it comes back out and reinfects the body. But they can also hide in scar tissue. They love the joints.
Yep.
Okay. Worms love synovial fluid. So you can find that in the joint. You can find that in the brain. And that's with MS. MS is a little microscopic worm. There was a doctor, Dr. Alan McDonald, years ago, found that MS was a microscopic worm that would get into the brain. And so the last time I mentored with Dr. Cowden, he was talking to some of his patients about that. And you actually have to take things to carry it across what we call the blood-brain barrier and actually get into the brain. And if you don't cross that blood-brain barrier and go after those pathogens, people that have neurological symptoms are not going to resolve.
What do you think the biggest mistake people are making from a treatment standpoint as well as like a patient standpoint with Lyme? What's the biggest mistake you've seen? Is it the not doing the Parasite Cleanse?
Yeah, well, there's a lot, Ben. There's so many. I had a guy come to me a couple of years ago that had actually been to a very expensive clinic out in Arizona, and I won't name that clinic, but it's like $65,000 to walk in for treatment. And they'd missed a lot of things. A lot of practitioners never look in the mouth. And they're, if you have amalgam fillings in the mouth, the silver fillings, or if you've had those and you've had them replaced and you didn't go to a biological dentist and get it done correctly, you got a load of mercury toxins released into your body. And you have to chelate that metal out of your body. And that metal is what these pathogens love to feed on. So if you're not chelating metal out, they have a food source. So that's one thing people miss is getting the amalgams out. Another thing they miss is scar tissue. People that have a lot of scar tissue. So you have to detox that scar tissue. With this one guy, he had chronic migraines for years, and it was the Lyme in his brain. And we actually used some antiparasitics, and we used some DMSO with him, which is what Dr. Cowden had taught me to do, to cross that blood-brain barrier and get those products into the brain to kill the bacteria and also the parasites that were in his brain. And he got relief from his migraines for the first time in many years, and he was symptom-free from those migraines. So there are a lot of things that practitioners, and it's not, they're just not trained in what to look for. So,
How long are you seeing treatments last, for
a Lyme protocol?
For a typical Lyme patient, is it like a 6-month process?
Well, it's going to be a little more because you start with your Parasite Cleanse, and that's a 4-week process. And then after you do that, typically you're also working on fungal infections at the same time. And then to start the Lyme protocol, again, you're titrating up to a full dose. Once you reach that full dose, you're going 8 weeks at a full dose. Okay. And then once we do a cycle, I use Dr. Cowden's protocol, which is cycling some products off and on and changing what you're using. Because you don't want to use you wouldn't want to use the same antibiotic. We don't want to use the same antimicrobial. Sure. We don't want to, so we cycle that. So after 8 weeks of being at full dose, then we go to another set of antibacterials. And we do that for 12 days. And then we have them come off for 2 days, and then they switch back to the set 1. And they do that for 12 days, and then they go off for 2 days. And it's a cycle because you're also targeting the life cycle of the pathogen, okay? So that's very important. And that's another thing when traditional medicine, it's just 6 months of antibiotics straight. There's no cycle. So they can't, if you've got eggs, they're not hatching out. Okay, so you do that cycle for 4 months. So a total of 6 months on antibacterials, and then prior to that, 4 weeks of a Parasite Cleanse. Sometimes there'll be some residual, and you'll have to go back and add a little bit more time to it. And every patient's different.
That's fascinating, though. Honestly, that's very, like you said, hopeful. That's,
there's hope.
For someone who's, if they've been dealing with this for a long time, if they've been feeling really bad, even for a short time, this is a super exciting to me.
Yeah, I mean, just like the girl I had in my practice last week, she said she'd been sick 15 to 20 years.
Yeah.
And
6
just
months?
in pain. She was in so much pain, and all we've done on her so far is the Parasite Cleanse. So 4 weeks.
So you're going to start to feel better pretty quickly.
She saw a dramatic improvement.
Okay.
Yeah. And she just mentally, emotionally, she said, I'm not dealing with the depression, the anxiety. And that's another thing that Lyme causes is anxiety.
Sure.
But the neurotoxins, not just knowing I have Lyme disease, oh my goodness, I've got a diagnosis. But what people don't realize is these bacteria release neurotoxins into the body, and that will affect the brain. It affects neurotransmitters. So the anxiety, like a lot of people are, when they get the Lyme knocked down, it's like, oh wow, the anxiety goes away.
Yeah.
Yeah.
It's super fascinating.
Yeah. It is.
Well, Dr. Sammons, thank you so much for explaining this. I know there's so much more we want to probably cover with Lyme. We'll have to do that in another episode, hopefully.
Sure.
But for the people watching who have been dealing with it, how can they find out about you? Where do you want them to go to?
Sure. You can go to our website, Sozo, S-O-Z-O, Wellness, TN for Tennessee.com. You can call our office at 423-543-7606 and go to our Facebook site, Sozo Life and Wellness. We have a lot of video testimonies on there, and that's what speaks for itself. I mean, I can stand here and tell all kinds of things, but when you can hear someone give their testimony, what they've been through and where they are now, that's what speaks for itself.
That's amazing. Yeah. Thank you so much, Dr. Sammons, for being here again today. And we're going to have to get you back on the podcast.
Thank you so much. I appreciate the opportunity.
Thank you, guys. This has been Outside the Box. I'm your host, Ben Rogers. As always, we'll see you guys next time. Don't go away.